Hello, hello. All right, let's get Steve in here. Hello.
Afternoon.
How
Well,
are
it's
you?
afternoon. I'm great, man. Yourself?
Good, good, good. All right. So, uh, today we're talking about shoulder stuff.
Shoulder stuff.
Yes. Let me just say a quick hello. We got a few people here. Rohit Verma. Hello, hello. All right. So,
So,
yeah, go ahead.
yeah, well, basically, I think so. Like, obviously, the shoulder is an insanely complex joint. One of my favorite things to tell people is, you ask them like, how many contact points between bones do you think there are in the shoulder? And that there's one. Like
Yeah,
people would you assume like this, like you see some of the stuff people can do with their shoulders. It's this massively complex joint, but there's really only one bone on bone contact, and it's the clavicle to the acromion, right? So
yeah,
everything else is this soft tissue. So as a soft tissue expert yourself, you know better than most the types of things that you can see.
yeah, for sure. So, for today, why don't we go just do a quick little sort of anatomy overview just for the people watching so they kind of get an understanding of some of the bony landmarks, understand some of the musculature we might be talking about. Just a quick, sort of
Mm-hmm.
simple uh, rundown. I'm going to try to actually use my skeleton here. So if you want to kind of walk us through, Steve, and I can kind of use Slim here as the visual guide for anyone watching.
Yeah, absolutely. I think the most important thing for the average person to understand about the shoulder, and that was one of my big talking points that we were before coming in here, is that the shoulder is really two parts. All right,
Mm,
it's two segments. So a lot of the times people train the shoulder as, or they think of their shoulder joint as one moving part when it's really two. So if you spin your model around, the shoulder complex. So I'm going to refer to it as the complex now. So the shoulder complex is really comprised of two parts. So you have your scapula or your shoulder blade, which is that sort of triangle, yeah. And then you have the glenohumeral joint, which is the head of the humerus that goes into the ball and socket. So a lot of people, when they think of their shoulder, they're really only thinking of that ball and socket joint,
right.
and they're completely forgetting about that shoulder blade, which is really, that shoulder blade is that base of support. So we talked about, when we did our foot one, we talked a lot about how if that foot as the base of support isn't doing what it's supposed to do, you have this cascading effect. The
Hmm.
exact same thing happens with the shoulder. So if we just said that shoulder blade's your base of support, and you're trying, any force that goes through your hand isn't going to be stabilized, so something else is going to have to compensate. So
Yeah.
those are the big things, I would say. It's just thinking of, if you take anything from this live little session, is when you are training and when you are moving, think of what's actually happening. Are you treating your shoulder as two parts or one?
Yeah. Yeah. Definitely. Yeah. There's a lot of little cool nooks and crannies to the shoulder and a lot of things, but I think you're right when we talk about the relationship between the scapula and shoulder range of motion or shoulder function. You can't separate the two. You kind of
Mm-hmm.
have to look at what the scapula is doing. Is the scap stuck? Is it rotating properly? Because again, we'll get into this, but impingement syndromes was kind of the big topic for today, and why people get stuck trying to lift their arm into this abducted position. Because there's a few different things that can cause that, but the real star of the show is going to be the scap and
Yeah.
understanding how many degrees we should be seeing in that scap. And you might know, or you probably obviously know, something we often refer to as scapulohumeral rhythm, right? There's a certain
Mm-hmm.
certain amount of degrees that the scapula should move for every degree that the humerus moves, right? So we can talk a little bit about that.
The way you just described it there is perfectly. So one of the things I like to think of the shoulder blade as, the shoulder blade is going to be that rate limiting factor. So if your central nervous system knows that your shoulder blade doesn't have proper range of motion and strength, it's going to limit what can actually happen at that humerus, because if it's not being supported, it doesn't want that shoulder or that actual ball and socket joint to go any further, because it knows that's a dangerous, unstable position to be in.
Yeah.
So maybe we go on from, so we've talked about the two parts, but so think of the shoulder blade has essentially four major planes of motion or directions that it should be working in. All right. So I don't know if your shoulder blade moves there.
So what do you want me to, which ones do you want me to show?
So essentially I'll just sort of demonstrate from this position. So essentially the shoulder blade should be able to elevate. It should be able to protract. Yep. It should be able to depress. It should be able to depress and retract. All right. So essentially, but the thing is, those positions aren't mutually exclusive. You should be able to have elevation and protraction, or depression and retraction, or retraction and protraction. Any one of those positions needs to be able to move in conjunction with the other. And where people get into problems is, so a lot of the, almost every single person has heard of shoulders down and back. All right? Sure. That's something that a lot of people cue. A lot of people are constantly saying, all right, this is a safe position to be in, down and back. The problem with that is, though, 95% of life situations don't occur in shoulders down and back.
Yeah.
All right. So you think of just something simple like opening a door or putting groceries away or putting plates up onto a shelf. Like, yeah, exactly. So like for you to try and go and reach that book off the top shelf, you wouldn't be able to do that without protracting your shoulder.
Yeah, exactly.
So a large number of shoulder injuries actually occur in that protracted position. So one of the biggest mistakes, and this is something I used to do when I was training people when I first started, I wouldn't train, say if someone's doing a lat pull down, I wouldn't train the relaxation portion. I would try and keep them in that retracted position the whole time, because I thought, oh, that's the safe position.
Yeah.
But so when I talk about, when you think of working the shoulder joint, I want people to be thinking of actually using that shoulder in a sequence while they're doing their exercises. So training that protracted position, no matter what the movement is as important as training that retracted position.
Absolutely. So why don't we get into a few of the sort of pathological things that we often see. We can start with just our classic shoulder impingement syndrome. This is supposed to be sort of the main topic of discussion. So in your experience, how often do you see shoulder impingement syndromes, and like what are the main culprits that you find cause that?
I'd say probably the majority of upper limb issues that I see are shoulder impingement. And one of the big ones is, so essentially at the front, I sort of make a joke. So anterior shoulder pain, I kind of make the joke that this part of the shoulder is like a roundabout with 8 roads coming into it. Mm-hmm. Right. So if you think of it, this insanely busy intersection where there's lots of muscle tissues, tendons, everything coming up, like your lat comes up underneath and attaches your bicep. So one of the biggest ones I would probably see is that, and that you could talk about helping people release, is that long head of the bicep.
Yeah.
So if you think of your bicep as bi, meaning 2. So on your model, I think there's probably they show the 2 insertions of the bicep. So one of them inserts, exactly, on the, there you go, exactly.
This is the sausage.
So one of them, so the bi, the being 2, so one of them originates on the bicipital groove, and then the other one originates on that, exactly.
Yeah.
the coracoid process. So those two parts, so if you think of people, and this more so men, we're constantly doing, they're doing a lot of bicep heavy exercises. So if you're not using a full range of motion, but also just the positions we sit in, we're constantly on our phones like this, we're sitting on computers, those biceps are always in a tight position. So
Yeah.
I find a lot of that anterior shoulder issues actually is causing from an overload of tension in the bicep in that origination. So maybe you could talk about some things that you do yourself, but then also things people can do themselves to help release that.
Yeah, so if we're talking about bicep stuff specifically, there's some pretty simple stretches you can do for the bicep. Now, like Steve was saying, bicep, there's two heads to the bicep. So there's two components. There's a short and a long head. But when we look at stretching the bicep, if it's something where we're just trying to restore length in this particular group, it's important to know that the bicep has three main actions, okay? So bicep does elbow flexion, it does shoulder flexion, and it also supinates the hand. So those are three different things. So if you want to make sure you're getting the best bang for your buck when you're stretching the bicep, you want to incorporate all three of those positions to make sure that you're lengthening it as best you can. So that would mean that the shoulder needs to go into extension, you need to go into pronation, and you need to go into, which one am I missing? Extension, elbow extension, shoulder flexion, shoulder extension, and pronation. So this could be as simple as kind of taking your arm on some sort of surface. I don't know if you guys can see, turning the palm over and just kind of allowing that bicep to stretch. Again, if this is a length issue, and if the bicep is chronically shortened, and remember, because of where the bicep attaches, the coracoid, it can influence shoulder blade position, because anything that attaches to this coracoid will have a tendency to kind of pull it and put it into the sort of anterior tilt. And when you and I, yeah, go ahead.
Well, I was just going to say, so if you go back to that stretch position you had on the on the shelf there, also paying attention to, because it does attach to the shoulder blade, paying attention to your shoulder blade position when you're trying to get it. So if it is insanely tight and you put your arm up and try to stretch it, your body is going to try and compensate. And so you're going to have this big roll forward protraction of that shoulder. So experimenting with, okay, well, if I retract or if I depress, moving that shoulder blade around to try and find that area of tension and then staying there is going to be the key to really improving.
Oh yeah, and it's cool because you definitely feel it. You'll find your sticky spots, as I like to say, like where you really, yeah, and that's usually where you want to spend a little more time, just finding those little nuances.
Well, and it's so individual too. Like your sticky spots are going to be different than my sticky spots. So so a lot of times people will say to me like, "Oh, I don't think I was doing it right, so I didn't do it." And it's like there is no right or wrong. It's a lot of it. I try to sort of make it like tell people like, be adventurous with this, like experiment, find those pathways, those fascial lines that are under tension, because I'm going to have different than you, because my structure is different than your structure. My body experiences different loads than yours does. So
exactly.
Situations.
Yeah, exactly. And that's I like to use the word exploration, right? When you're doing any sort of series, whether it's something you found on YouTube or you read in a book, definitely take some time to explore, right? There's no right or wrong. It's whatever's stuck for you, and everyone's going to be a little different. So we talked about bicep, how it influences shoulder.
Time out as well. So you said that third function of the bicep is that supination of the arm. So one of the issues I find people get with that shoulder pathology is if you're only working the bicep with one grip. So if someone only ever does easy curl bicep curls, they're only working that bicep in one grip. They're only training it in that one position. So one of the biggest things I found with people is training Zodovan curls. So Zodovan curls are probably one of my favorite arm exercises there are. they're so functional in terms of grip strength, wrist health, elbow health. So a Zottman curl essentially is you start with a bicep curl in a supinated position as much as possible, and then at the top, and then you pronate, keeping the elbow in, and you go down on the bottom. And if you're really focusing on that shoulder, so scapular depression, supination on the way up, pronation on the way down. So it's, in terms of an elbow flexion exercise, it's probably my absolute favorite, because if you think of a lot of the pathologies that we see, carpal, I had like a brain freeze there. Carpal tunnel, tennis elbow, golfer's elbow, shoulder, a lot of those. So essentially what you're doing with that Zottman curl is taking that elbow wrist complex, shoulder complex through a full range of motion.
Yeah, I love it. So that's a great tip. Yeah, for those of you who are looking now, that would be more for shoulder rehab, general strengthening.
Exactly. Yeah. And the big thing and the coolest thing is, so you can literally do those controlled articular rotations I talked about in our first one. That's literally the elbow. So if you have sort of any elbow or wrist pathology, we're doing what I said I wasn't going to do. We're getting off on a tangent.
Yeah,
but
it's all good.
Literally doing that with just your hand can be enough to introduce some new movement there. But again, everything in the body's connected, so it's not really a tangent, because like you said, that elbow has those two connections. So if a muscle crosses a joint, it's going to produce movement there. So even though, and maybe, so I'll tie this back in. If you are having shoulder issues, pay attention to what your shoulder's doing when you're doing other exercises.
Yeah.
So the amount of times you see people doing an arm workout and their complete lack of regard for what their shoulder blade is doing, that's going to lead to issues. So there you go. I tied that back in.
But I like that. That's really good, because it's important, right? We don't often see it and we don't realize it. But I mean, as movement coaches, I mean, it doesn't take long to, you just scan a gym floor and you see how many people doing all sorts of movements that are not shoulder exercises, but the shoulders very involved exercise somehow. And usually I find it's in this, this shrugged position. People are usually dominant in this upper trap section here. So we find this,
absolutely.
A very common thing when exercises get hard, whether it's an overhead press, whether it's a bicep curl, people tend to like to recruit here. It could be a pull. They like to recruit here. It could be a push. They like to recruit there. It seems to be a common pattern.
Well, and that absolutely ties into that shoulder impingement, because the second thing that really that we can move on to is, if it's not the bicep that's creating that tension in the anterior side, it's that elevated head of the humerus, and that's 100% being caused by that overactive upper trapezius muscle. And the body doesn't do things randomly. All right, it's so our muscles in our central nervous system aren't doing things because the brain wants to. It's simply reacting. So it's reacting to load. So if you're sort of anything inferior to your shoulder blade, so your rhomboids, I'm gonna get rid of the chair. So your rhomboids, your lats, everything like that. If you don't have developed or control anything inferior to that shoulder blade, your brain realizes that it needs strength, so it's going to create tension up here to create support. All right. So there's a reason for that tension. It's not just there because it's there to try and create. So your body wants stability, and you're either going to create stability one of two ways. You're going to have strength in those joints, or there's going to be that tension that's being created from the central nervous system.
Yeah.
So one of the best ways to reduce tension in the upper neck, or this goes for any joint. So if you have tension on one side, one of the best ways to do is contract that joint in the opposing direction.
So let's talk about
All
that
right.
for a sec, because we talked about the upper trapezius being the dominant set of, uh, muscles in shoulder mechanics. So when we talk about, one of the best ways to relieve tension in a muscle is to activate its antagonist or its opposite.
Exactly.
I think is what you're
Yeah.
trying to do. So when we look at the upper trap fibers, it kind of goes from here to here. And when you look at the trapezius, it's sort of fans in this diamond shape
Yeah.
sort of orientation. So you could sort of divide it into three main sections. You got your lower traps, your mid, and then your upper fibers. So if your upper traps are the ones that are constantly forcing the shoulder to go into the shrug position, how would you go about activating its antagonist? So its opposite would be the lower traps here. What are some good lower trap exercises that you do that have worked with your clients?
So the big thing is one of my favorites is actually a all fours position exercise. So because one of the hardest parts is people cheat. So if you're on your hands and your knees, essentially the biggest thing I want you to do is you're simply going to keep your arms locked. You're going to lower your head and chest down to the floor. So that's retraction. And then
Yep.
press your hands into the floor, coming up into protraction. So that's the start. So we're simply just trying to move in two different directions. So one plane of motion, up and down.
Yep.
And then what you can start doing after that is introducing elevation, so up to the shoulders, and then depression away. And then once you really get the hang of it, you can actually start creating full movements. So I'm actually taking my shoulder through all four positions, and that's a really, it's amazing how many people will start to do that, and they just have this complete brain meltdown because they're like, oh, what, or their elbows start to try and bend. So it doesn't look like much. And the reason I like that one is because there's actually a little bit of load on the shoulders too because of your upper body weight.
It looks like a sort of a closed chain version of the shoulder clock exercise, right? Just getting the shoulder.
Exactly.
Sometimes people have been taught to do it up against a wall, where you're kind of doing this clock exercise, and you're trying to get that shoulder to move through, every hour on the clock, if you will. But I love that one. That's a cool little variation. That's pretty neat.
And it's all about putting people in positions that reduce the ability or the chance to compensate.
Yeah.
All right. Actually, an even better version. Sorry,
Yep.
my brain's going. So an even better version is actually on your elbows.
Yeah.
Because a lot of the times, if somebody has so little ability to communicate to their shoulder blades, and you put them on their hands, their elbows are just going to bend,
Yes.
and you're not getting any benefit out of it. So if you go down on your elbows, and all you focus on is retraction and protraction.
Yeah.
So my head and chest are moving about 6 inches there, and the only thing moving, so maybe this is a better view. So I'll keep my head neutral.
Yeah, that's pretty cool.
That is
your shoulder blades are kind of going into a retraction, and they're just gliding off the rib cage.
Exactly.
Position. Yeah, that's pretty cool.
But that gives you, and if you think of in terms of sport mechanics, any type of throwing, golf, anything like that, it's all about leverage and range of motion. So if I go to throw something, if I don't have the ability to control my shoulder blade, it massively reduces your movement options.
So this goes back a little bit to what you were saying earlier in the talk about, early on as a trainer, you didn't really train the muscle into a protracted and elevated position because we were kind of conditioned as trainers that that's a bad position. Don't do that. But it's not about good or bad. It's you want to be strong in those positions if they apply to something that you're doing. We talked about throwing, right? You have to be able to move your shoulder into an elevated and protracted position if you're going to move through that range of motion efficiently. So it's fine. But I think what we see from body work, from manual therapy, massage, and stretching is that, we definitely want to give athletes and people who are doing a repetitive movement in a sport, relief from those positions. But we always want to take them back to their home position. For a lot of people, again, if it's a throwing arm, whatever it is, we want to unwind, give them some relief, right? Take them out of that position that they're kind of chronically shortened. But always make sure they're still kind of training in those ranges, because that's their sport, or that's their activity. That's what they need, right?
And and one of the things I think would be cool is people out there. So there's a lot of sort of like your standard, if you YouTube, like your standard sort of track stretches and things like that.
Sure.
And by no means am I saying those are bad, but what I think we're both trying to say is introduce some active antagonist work right after. So if you are going to try and release those upper trapezius muscles or those upper neck muscles with some of these more sort of standard practices, focus on, do a 20-second isometric contraction where you're driving that shoulder blade down. So you're going to feel a stretch here. Put all your thought into using your lats, using everything, pull that shoulder down. That's really going to reinforce that new position for those muscles, because like I said, the brain's not deciding to be tight.
Yeah.
It's reacting to the stimulus that we're putting on it.
Exactly. So that would be an example of almost like an active stretch. So another quick analogy for those of you who are maybe still trying to understand, if you wanted to stretch your tricep, a simple way to do that without actually having to go into this sort of position is just to maximally contract your bicep. Right?
100%.
If you maximally contract your bicep, your tricep has to lengthen, right? It's the law of reciprocal inhibition. It's the nervous system. That's just how it works. So, and it's a safe way to stretch.
You're warming my heart right now, Rui. But so we had that talk about the neurological tightness.
Yeah.
If your tricep feels tight, or if your tricep is tight, and you maximally contract your bicep, like you said, because your brain is doing that, it's not going to think this is dangerous. It's going to allow you to relax. Whereas if it just gets forced into that position, there's sort of this inhibition, like you said. So that makes me so happy that you just said that.
Yeah. So it's a great, safe way to stretch. Absolutely. And we should probably do some more videos in the future on that, because that's one that doesn't often get talked about or looked at. I mean, we get taught all sorts of fancy stuff using balls and rollers and bands, and active stretching is a great way to kind of combine that into the routine too. It's really, really good.
Absolutely. I think probably the third thing that I see is, so we have biceps being extremely tight, overactive, trapezius. The last one is just a general external rotation or rotator cuff weakness.
Yeah.
And the amount of people that I've worked with where they will start to do an exercise, like, oh, hey, this was my physio exercise.
Yeah.
And I'll ask them, well, why'd you stop? Well, because it was better. And so if you aren't doing rotator cuff exercises 2, ideally 3 times a week, you're not doing enough to actively keep your shoulders healthy. Because and even more so, if you're doing pressing twice a week, or if you're doing, like, CrossFit individuals should be doing some sort of rotator cuff exercise with every single exercise, every single workout that they're doing, just because of the demands that they're putting on their shoulders. If you do overhead press work, like, I don't know about you when you train and when you see people, but the amount of clients that I have, like, I've probably got 25, 30 clients right now. I'd say 2 of them have the prerequisite shoulder to go overhead.
Yeah. Yeah.
Like,
it's quite, it's not good. Yeah.
The amount of, and you have to look at your exercise selection in terms of your risk versus reward.
Yeah.
You ask someone why they're doing an overhead press. Most of them don't, because I'm training my shoulders. But are you really? Because if you're in this position, doing an overhead press, because you don't have the active shoulder flexion. So if this is a test for people at home. So if you pull your rib cage down, so I'll make sure everyone can see. So if I pull my rib cage down and contract my abdominals as hard as I can, keep my arm arrow straight, and slowly, keeping your arm straight, try and bring that arm straight up into the air, but keep your abs tight, 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 tight.
That's hard.
If you can't, so if you can't get your arm up past your ear without your lower back trying to extend, you shouldn't be overhead pressing.
Yeah. Yeah. So
like,
we do a similar test called yeah, we do a similar test. It's a wall angel or wall arm slide.
Exactly.
And it's so funny how many people will cheat and they'll just completely arch their back like, oh, this is easy. I can glide my forearms against the wall. And then as soon as you get them to pull the rib cage down, it just, you know, they don't even have contact with the wall. So it just shows you how smart they are in that sort of flexed, you know, adducted position.
So if you think of that in terms of load and intensity, so you think just how many people have to compensate to get the weight of their arm over their head?
Yeah.
Now try putting 135, 200 pounds on a bar and lift overhead. And again, if you're in a CrossFit competition and the goal of the exercise is just to get the weight up overhead, okay.
Sure.
But having a stronger shoulder inflection is always going to increase because there's going to be a limiting factor, and at some point your body's going to reach it.
Absolutely. Yeah. Competition is a different thing. But for just regular everyday people who just want to move, they want to be strong, they want to be healthy, definitely not worth it. If you're, and like Steve and I were saying, if you can't get your shoulder in that fully flexed position without cheating, you probably don't have any business pressing anything heavy over your head because you're just, in body work and manual therapy, that's just what we call a recipe for disaster. It's to trash your shoulder joint. Let's quickly talk about the rotator cuff. I'm just going to go into a few details on rotator cuff because this is one that I think is often maybe misunderstood because people, I think they get told rotator cuff, you know, tear or strain or something, but they don't actually know that the rotator cuff is not one muscle. It's actually 4 muscles and they all have sort of different positions and functions. But the big one that often gets compromised in shoulder impingement syndromes is one we call the supraspinatus. So supraspinatus, you can see Slim here, this little sort of groove here, this is where that supraspinatus muscle starts, and it actually passes through under this bridge, which is your acromion, and attaches to your humerus. So when this muscle shortens, it actually helps abduct that humerus. But again, if we have a dominant upper trap, okay, and we're constantly recruiting here, exactly, it's going to jam up and force that humeral head to basically compress and pinch what we call that subacromial space. And it could be we got burses in there that often get inflamed. This is where tendinitis happens at the supraspinatus, all sorts of stuff. But again, this is something, you see it so easily. It's just this constant jamming of that joint anytime you shrug before you go into some sort of movement. Usually when people get into rotator cuff problems, it's usually supraspinatus issues. Would you agree?
100%. And tissues do not like compression or because essentially what that compression creates is friction. And that friction, because things can't move, because there's friction, it's going to create that lack of movement, but also it's going to create irritation of those tissues, inflammation, creates more friction, and it's just sort of this cascading cycle.
Yeah, exactly. Yeah.
So a quick little test for people at home. If you put your elbow at 90 degrees, bring your shoulder blade down, you should be able to externally rotate that shoulder straight out to the side. So see how Ruiz is coming all the way out, his hands pointing straight towards the camera. So that is I'd say sort of the standard healthy shoulder external rotation range of motion.
Here's what most people will do.
Exactly. Or they start extending their lower back. So if you're coming around to the edge there, and if you're feeling any sort of tightness, if you're feeling any sort of impingement or pain in the front of the shoulder, there's a big issue going on there. But a lot of the times it's just a weakness, and they're not going to be able to actually create that rotation.
Yeah. So let's get into some of our tips and tricks before we wrap up. For someone who's doing shoulder exercises and they're experiencing pain, specifically if they're experiencing pain going up into that flexed or abducted position, what would be your advice for someone going through pain?
So if you're experiencing actual joint pain, it means the movement, you don't have the prerequisite range of motion or strength for that movement. So you're going to have to start thinking about modification for it. So if it's load related, decrease the weight and just focus on the shoulder positioning in that movement. So whether it's a pressing exercise, say when you're lowering the weight down from a bench press, actively thinking about engaging the lats, engaging the shoulder blades. If it's a pulling movement, same thing, releasing the shoulders. So a lot of people will get pain in their like a chin up or a pull up position. So thinking about where is your shoulder throughout the whole movement too, not just at the bottom. So a lot of people will retract the shoulders at the bottom, and as they start to get to the top of the movement, they lose it and they end in that position.
Yes.
So people have to think of fitness as a long-term game.
Yeah.
It is always better to move with less load and full controlled range of motion because sure, if you go up 5% or add another 10 pounds, you set a PR, but then you blow your shoulder out and you're set back.
Yeah. Yeah. And we see it in gyms all the time. Like people will, they'll be working through a movement and it's clearly way too heavy for them, right? And you can see they're not working through a full range, or they're just compensating and they're squirming like a centipede to get that bar down on that lat pull down. When all you got to do is just decrease the weight by 5 or 10 pounds, and you're going to get stronger faster with less chance of injury doing it that way. But we have this thing called egos.
Oh yeah.
They really get in the way, but it's important to kind of just leave that out the door when we go into a gym, I think. So.
But sorry, tips. I would say actively when you're doing a warm up, like doing a warm up of using your shoulders through that full range of motion. So, and the thing about these shoulder articulations is you can do them in any position. So down by your side is your start. So shoulder blade forward, up, around and back. But if you're going to be training an overhead position, taking your arm into that overhead position and then literally warming the shoulder blades up in that position. Or before a pull-up session, I love doing scapular retractions.
Yeah.
So literally hanging from a bar, keeping your arms straight, pulling yourself up, just retracting the shoulder blades, squeeze and hold, and then lower down. Exactly. So it would look just like that. So imagine Rui's arms are on a bar. So that is an awesome way of priming. Yeah, that was really good. So that is an awesome way of sort of priming the central nervous system and warming those shoulder scapular muscles up, and then trying to really create that movement and keep that in.
I love that. So for people who are experiencing shoulder pain in an abducted or flexed position, or any sort of overhead work, if you're experiencing pain, so it sounds like you said, definitely work through a good thorough warm-up. You can troubleshoot, I think, maybe a lot of things through movements with shoulder pain. But what if someone they just keep getting pain, and maybe they're not sure if it's joint pain or muscle or what's going on, but at what point do you say, okay, maybe we shouldn't be moving things, and at what point do you refer out, and what would be your referral for something like that?
I think it's so hard. So essentially, if you get pain with a body weight, so if you can't complete a shoulder articulation like this,
right,
without some sort of pain, because that's essentially that should be like bare minimum. You should be able to do that.
Yeah.
So if you don't feel comfortable, like you definitely need to see somebody, because there is an underlying issue going on. that if you put any sort, like if you can't do this movement without having some sort of shoulder issue, you have zero right to be doing something with weight.
Yeah. So I think that's important for people, anyone watching who maybe is, they're going through these home workouts, if you will, and with very little supervision. Definitely, yeah. Don't push your body past what we consider bad pain. So there could be some underlying issues going on, and definitely maybe reach out to a skilled movement coach, a therapist, physio, that could maybe kind of take a deeper look at what's going on. But yeah, because I think there's probably too many people out there who work through stuff that they should probably be taking a small step back. They're probably creating a little more damage than they are, than anything else.
And so one of the something that people can do at home.
Yeah.
So for rotator cuff, it's called a passive range liftoff. All right. So essentially, because a lot of the times it's end range of motion that people are having issues with.
Yeah.
So if you can have a book, you can have a block. It doesn't have to be, and even people on the floor, that can be enough. But so let's say, actually, I'll show you on the floor. So if your forehead's on the ground, your arm's out to the side. So you're going to bring your shoulder blade back, and now you're going to try and externally rotate, lift, and hold. All right? So even though it's just the weight of your arm, at that end range of motion, I would bet 80% of the people that we would ask try and do that are going to get massive cramping in the outside of their shoulder, because that's a position that they're not used to. But really what we're doing there is training that base position, but in a reduced load situation. Yeah. So that's a really good one. Another one people want to try, laying on your side. Again, you don't need any weight for this. Have your elbow on your side, pull that shoulder blade back, keep the elbow at 90 degrees. You're going to try and externally rotate and achieve that straight up and down. This movement, if you have a 3-pound dumbbell or a 5-pound dumbbell and you really use that full range of motion, try and pull it back and in, you're going to create an incredible amount of load and work for your shoulder blade to do, and it's super, super safe.
What would be like a good sort of, in terms of exercise variable, would you say 15 to 20 reps, 10 reps, 5 reps? How many sets what's a good sort of just generic starting point?
So essentially with those ones, with the rotator cuff, we really want to go, because so if you think of rep ranges, we want to go for, once we get through a pain, like if you're doing like a rehab type thing, you're going to go lower load, higher repetitions.
Right.
But once you start getting past, once you're past sort of that rehab phase and there's no chronic issues going on, then you want to start lowering the reps with like a 6 to 8 reps, which is where I usually work with my rotator cuff. Sure. Once you're past sort of a rehab phase, but if you're in a rehab phase, you're going to be higher up in that repetition range, like 12, 15 reps.
Right on. Perfect. Beautiful. I love it. Okay. That's awesome. Steve, is there anything else you want to add before we say goodbye?
No, I think that was, just think of your shoulder as 2 parts. Anything you do, it's not just what are my hands doing, it's okay, where are my shoulder blades? Yeah. So letting those shoulders retract, pull them back together. Yeah.
Good. Awesome.
Same thing with your push-ups. Like, where is your shoulder during your push-up? Are they up by your ears? So your shoulder blade is a complex. It's 2 parts. It's not just one.
Yeah. Yeah, definitely. I love it. So what I'm going to do is I'm going to repost this on our story again, and I will be putting this up on our YouTube channel as well for anyone who wants to rewatch this later down the road, because those are some really solid tips. We got some good little do-it-yourself exercises and warm-ups that you showed, which was awesome. So I hope, again, today was helpful for everyone watching. And if you have any other questions, concerns, or even requests, anything you want Steve and I to cover, just let us know, and we'll cover that in a future video, because again, these are awesome. I learn a lot. I hope everyone watching learns a lot, and this is all really, really fun stuff for you and I, because we're total nerds about this, but I just hope that everyone watching is getting some value from it. So I guess with that, we'll say sayonara, and I'll see you on the next one, buddy.
Yes, sir. Have a great day. Take care.
Bye.